Good afternoon. I'm going to talk about our evaluation entitled Communities Addressing Gambling Harms. This evaluation looked at the local partners' use of a community of practice to drive social innovation in this emerging public health field. It concluded in 2023. Okay, so what was the problem the local partner was trying to address? As I'm sure you're aware, gambling harms is increasingly recognised as a major public health issue of global concern. However, despite its severity and scale, we lack really a basic understanding of the evidence base around interventions for addressing gambling harms. One reason for that huge evidence gap is the gambling's disproportionate influence. The gambling industry's disproportionate influence on prevention, treatment and research. Many existing educational campaigns, like the well-known campaign When the Fun Stops Stop, is incredibly ambiguous, and increasingly evidence suggests it's counterproductive and potentially stigmatizing. Furthermore, a particular type of intervention, community-centred approaches to gambling harms that are independent, with all their potential for trust building, cultural relevance and peer-led support, these remain underfunded and underexplored. And it was those evidence gaps that the local partner formulated a community of practice to drive social innovation in this area. So what did we evaluate? The focus of the evaluation was that community of practice, how the local partner was bringing together diverse community organisations in an attempt to stimulate innovation. So 12 organisations came together, many of whom were new to the gambling harm space, to participate in the COP and to develop and implement their ideas. So access and timeliness constraints meant our focus was not the organisation's interventions. We knew we didn't have time to get down to that level to really explore and evaluate the interventions at that level. So that is why we focused on the COP. But a secondary aim of the evaluation was to gather opinions and insights about what was working at that level. So there was an impact survey for this evaluation, but primarily it was qualitative. In total, 33 interviews and 3 well-attended focus groups formed the basis of the data. And these were carried out both at the midpoint and the end point of the project. Okay, so what did we learn? We found that community of practice are powerful tools for social innovation, and we think they're particularly appropriate in the context of politically complex and underdeveloped public health spaces like gambling harms. They provided a really protected space for community actors to come together, to learn, to share dialogue, ideas, and to mutually problem solve. Crucially, that community of practice provided a mechanism for amplifying lived experience perspectives. It also provided a mechanism for an integrated referral pathway such that if any intervention came across someone encountering gambling harms, they could be referred to an organisation participating who could provide that support. The COP also allowed for a collective identity and voice, and this was most notably expressed in the lived experience-led campaign that was formed through this community of practice, Odds Are They Win. And this was an explicit attempt to really counter the narratives of the gambling industry that gambling harms are the product of an atypical industry atypical individuals rather than a predatory industry. And that was distributed across Greater Manchester Combined Authority, who was the local partner. We also, as I mentioned yesterday, last slide, did glean insights about what was working at the intervention level. These insights suggested that lived experience-led community organisations can do a lot to complement NHS gambling harms clinics, providing very holistic and approachable support. And we also found that education for young people that incorporates a commercial determinants of lens talking about commercial tactics, manipulative marketing, and so on. It's extremely engaging for young people and also avoids the pitfalls of both stigmatizing and moralizing undertones. I did sneak in a fourth slide. I'm really sorry, Susie. I didn't get that. But I just wanted to share some of the local partners' feedback, because our approach of looking at that community of practice was ultimately prompted by them. And they're just saying here they wanted to acknowledge the excellent piece of work, but also the community of practice approach, specifically the model that we developed, enabled them to explore ways of replicating that in other policy themes. So bringing community organisations together through a community of practice to stimulate that innovation. They reported that they're exploring that in other policy areas. That's a really quite unique form of impact there. But the impact doesn't stop there. We also have national impact from this. So what we've been doing is actually working with the Gambling Harms charity, Gambling with Lives, to develop their educational program, which started in the community of practice as just one small idea, where we've been working with them to establish that as a national educational program. So what does that tell us? You know, in a public health, emerging public health area that is contested, where there is a lack of evidence, bring people together in a community of practice to drive social innovation and achieve that impact. Thank you.